This is Cable Channel 5, your local origination station serving the greater hub area.
Milk, yogurt, cottage cheese.
Good evening. I'm Dr. Robert Peppercorn, and this is the Yuba Sutter Medical Explorer. As a specialist in skin diseases and allergies, and as host of this program, I will take you on an exploration of the medical communities of Yuba and Sutter counties and bring you behind the scenes of medical care practices right here in our local area. Our program tonight will introduce you to our area's first resident to successfully undergo a major heart-lung transplant operation. Yes, our guest tonight is Nancy Brewer, who recently underwent successful heart-lung transplant surgery at Stanford Medical Center. Her presence here tonight is even more meaningful because you, the residents of the Yuba Sutter area, helped make her excellent health improvements possible by your generosity with the fundraising campaigns. Nancy will also tonight tell us about patients that also need our help to get this type of operation. Later in the program, you'll be introduced to the dermatology treatment called phototherapy, which uses ultraviolet light to treat skin diseases such as psoriasis. In the pharmacy corner tonight, our neighborhood guest pharmacist will teach us about the growing market of home medical test kits. Are these home testing devices really reliable? Well, we'll learn the answer to this question and others about home testing in our pharmacy corner tonight. Tonight's show will be extremely timely and very informative, and I hope that you'll stay with us for the next half hour. Before getting to our topic tonight, let's take a look at the latest medical news. An over-the-counter antacid may be an inexpensive alternative to prescription drugs in treating ulcer patients, according to a recently released study. The study of 200 patients in 4 countries shows that taking Maalox twice a day reduces recurrence of duodenal ulcers up to 25%. That's a 2% less effectiveness than Tagamet, the most popular prescription medicine in the United States, and at the prescribed dose, less than 1/4 the cost of Tagamet. About 10% of men and 4% of women in the United States will get a duodenal ulcer characterized by pain and bleeding. Although the direct cause of ulcers is unknown, stress is thought to be a major factor in causing stomach ulcers. Next in the medical news is good news in the fight against muscular dystrophy and cancer. 2 major studies in the British medical journal called Nature report that scientists have isolated specific genetic defects, one linked to a form of muscular dystrophy and the other to an eye cancer called retinoblastoma. The findings have implications far beyond these diseases. Discovering the gene defect responsible for an illness lets scientists more precisely trace a disease's development. The discovery of the muscular dystrophy gene by a Harvard Medical School team is being hailed as a breakthrough in Duchenne's dystrophy, a poorly understood and incurable form of muscular dystrophy affecting 1 in 3,000 U.S. infants. Researchers at the Massachusetts Eye and Ear Infirmary in Boston discovered the retinoblastoma gene. It's the first gene found to prevent cancer from forming. The cancer will not occur if the gene is present. The researchers speculate other such preventive cancer genes may also exist. Abnormalities in such genes may predispose some people to more common types of cancer, including cancer of the colon, breast cancer, and even lung cancer. The discovery will also allow doctors to spot kids likely to develop eye cancer, which can cause loss of an eye and even death. It's now time for us to visit our pharmacy corner as we learn the latest up-to-date information on the world of drugs and medications from one of our area's neighborhood pharmacists. Joining us tonight in the pharmacy corner is registered pharmacist Bob Church from the Medicine Shop Pharmacy in Marysville. Bob, welcome back to the Medical Explorer.
Thank you.
Always a pleasure having you here, and I really thank you for being here tonight as well.
You're welcome. Thank you.
I understand that there seems to be a constantly expanding list of home test kits that are available to consumers at local pharmacies such as yours. Do you feel that this expanding market reflects a greater interest toward a preventative medicine idea?
Definitely I do, and I think that's where they've all come from. They've basically come out of the doctor's office, been readapted for home use. It's really a market that's centered in the pharmacy as opposed to, let's say, the grocery store, because usually when people want to utilize one of these kits, they need some information to go along with it, so they have a pharmacist there to answer. So I think that's why we're seeing it in the drugstore so heavily.
I don't get into the drugstores too often. Tell me, what are some of the medical self-test kits now available?
Okay, really what's happening is there are some tests which do not involve kits, and one of those, the most popular in this country, would be breast self-examination, which is promoted by the American Cancer Society. As far as kits go, we had diabetic testing for a long time, whether it be testing for sugar in the urine. Now we're getting involved in blood glucose testing with the strips to read visually or by the use of a machine that will read it for you.
Are prescriptions needed for some of these?
No, they really are not at this point, no. Early pregnancy testing kits are available.
Are they accurate?
Fairly accurate, yes. And I think a lot of that depends on if the person utilizing is following the instructions carefully. But yes, they are pretty reliable. Blood pressure testing apparatuses are very popular with people. The occult blood tests for testing for hidden blood in stools as an indicator of colon rectal cancer are also very popular.
Well, your medicine shop pharmacy had a big screening program with that, using those kits that the people took home.
Yes. So there are a lot of things out there for people to self-diagnose with.
What does it look like for the future in new testing devices?
Well, there's some interesting things that have just come out. One of them is a product called, which is really in the physician's office at this point, but is geared for the home market very soon. And it's a 10-day urine-based early, well, it's an ovulation predictor. There's another one.
Now, that would be for someone who wants to get pregnant.
That's correct.
Okay.
There's another one being worked on right now that instead of testing urine, will test for an enzyme in the woman's saliva, and it's utilized by putting a sponge into the mouth. So that's interesting.
I haven't heard about these things.
That's new. There is another product which has just come out called gender choice, and this is very interesting. It allows a couple to predetermine what sex their child will be with an 85% reliability factor.
Using what method?
Well, it includes timing and positioning information, includes thermometers and tissues for determining when ovulation is occurring.
I didn't even know that was an accurate method of doing such a thing.
Well, they say it's 85% reliable, so that's a whole lot better than trying to do it on your own, I suppose.
Now, do these testing devices have to be approved by the FDA?
Yes, they do have to be.
So they fall into the same category as medications.
Right, but there are not really any clear-cut guidelines that cover all of these home test kits at this point in time. They're working on that to try and really standardize what can be available to the consumer and what can't. There's another interesting one that has just come out. It's called Aware, and it's designed for parents to test their child's urine for drugs such as cocaine, marijuana, barbiturates, and other substances. And I thought that was interesting.
I think that's very interesting.
In light of President Reagan's
federal drug testing program, absolutely.
The samples are taken at home the way I understand it, but the testing, the actual analysis, has to be done in a lab.
I wouldn't be surprised if someday people will be looking for an AIDS testing device they can buy at a pharmacy. I can just imagine the controversy that'll stir up.
Well, let me tell you that there are some testing going on and some products being worked on right now to test for infectious diseases such as sexually transmitted diseases, strep throat, and urinary tract infections. So,
you mean like gonorrhea would be something that you could test for yourself?
Absolutely.
Now, do you foresee the patients being able to come in the pharmacy and buying their own penicillin to treat these diseases?
Well, Bob, there's been a talk about that type of thing. I don't foresee that, no. I certainly don't.
I don't either. I don't think that'll go over well. That would have to be a major change in medical law.
Yes, I don't think we're going to see that type of thing.
I've read about some companies developing kits which will deal with the monitoring of drugs for chronic diseases like asthma. Theophilin's a drug there. Or epilepsy, they take Dilantin, the drug there. Is there something coming out with that?
There is one that is currently being used in physicians' offices, put out by Syntex Medical Diagnostics, called AccuLevel Theophilin Test. And with theophylline, you have to monitor drug levels in the blood because the level in your blood that gives you a beneficial effect as opposed to the level where you get a toxic effect is very close. And so this test can be utilized to give you, in 20 minutes, a theophylline blood level. And they are working on that particular test to adapt it to home use.
Do all these tests, though, really have a proper place in the home setting rather than a medical office setting?
I really don't think they all do. I can't envision the Centers for Disease Control and the FDA allowing people to test themselves for sexually transmitted diseases and then doing nothing about it.
Right.
The strep throat tests are, you use a swab technique, and when you're pulling that swab out, if you brush it against your cheek, tongue, or teeth, you upset the culture or the specimen. So there are a lot of reasons why some of these tests I don't think should ever to be in the home setting. As far as the one called Aware, I think people can make up their own mind about that one. I think it's rather bizarre. But
what's the real trend in this country? Who's using these kits?
There was a 50,000 home survey done last year by Patient Searchlight, and they got a 74.8% response to the survey. So it was a tremendous survey. Women, older adults, and people living in major metropolitan areas are the prime users of the kits. The southern part of the United States uses more self-home tests than any other part of the country, and a quarter of the households in that test over a 3-month period had used some type of self-testing.
Bob, this is very useful information, and I hope our viewers will discuss their questions about home testing with their physicians as well as their pharmacists like yourself at the medicine shop very soon. We look forward to having you back on our program very soon in the Pharmacy Corner. My pleasure. Now, on with the Medical Explorer. I'll bet that there are very few residents of our community who haven't heard about a recent resident who successfully underwent heart-lung transplant surgery at Stanford. The subject of transplant surgery seems to occupy more and more news media on a daily basis. Let's meet our very special guest tonight, who's going to tell us about her experiences as a heart-lung transplant patient. I'd like to welcome Nancy Brewer. Nancy,
hi, Bob.
Thank you very much for being here tonight.
Thank you. It's nice to be here.
You've never been on the Medical Explorer before, but I know you've seen it before and been interested in helping educate people about your experiences.
Right.
Thanks again for being here.
Thank you.
Tell me, Nancy, what was it like before your surgery? What was really going on with your symptoms? What was life like? How was it to be in that situation?
It was pretty bad. The shortness of breath, the chest pains, and being tired a lot, and not being able to do things that I wanted to do. It was very hard.
Was this just a sudden thing that happened to your health?
No, I've had it since birth, but they didn't detect it until about 1981 when I started having problems.
So what was actually wrong with the heart?
I had a hole in my heart and high pressure in my right lung.
So I'll explain to our viewers that what was happening here is that the blood that normally goes through the rest of the body under very high pressure, which is what our blood pressure is, normally that high blood pressure doesn't hit the lungs. It's normally the blood in the lungs is under much lower pressure. But the leak in the heart was allowing the blood to get into the lungs under that same high pressure, and that constant pressure on the lungs day after day, year after year, starts to actually make the lung toughen up and the blood can't flow in there properly. And that's what was happening. Pulmonary hypertension is the medical word they use.
Right.
So eventually the heart gets strained because it's pumping under this high pressure, and the lungs get strained, and you start suffering these terrible symptoms.
Right.
And how long had these symptoms been going on for you?
Well, they really started about 1979, but they were on and off, and then 1981 is when it got really bad. And I knew there was something wrong when I tried to climb a hill. And that's when I decided to go see a cardiologist because I couldn't breathe. And like I said, I was getting chest pains.
Now, was Dr. Kapos the one that found this?
No, Dr. Forster from Sacramento.
On Sacramento.
Right. And he said that there was a hole in my heart, but there was nothing that he could do about it. But yet it was operable. But yet I was a high risk because of the pressure.
The high pressure had been there such a long time.
Right. And this there was nothing he could do for me.
So how did you meet Dr. Nicholas Kapos here in Yuba City?
Well, I got a second opinion after Dr. Forster because I was scared. I didn't know what was going on.
I can certainly imagine that.
And so I went to see a Dr. Ellis down in San Francisco, and I asked him, what it meant. And he read my case and everything, and he told me I had 1 to 5 years. And without the heart-lung transplant, there was nothing nobody could do. There was no cure. So he made an appointment through Stanford for me, and I was rejected by Stanford in 1982 because of what was going on with my home life and my weight and everything. I wasn't ready, and I couldn't figure out what he meant. I wasn't ready. And well, after I met Dr. Kapos, he told me that mentally and physically you have to be ready, especially mentally.
So what held up the surgery at that point, once they knew that heart-lung transplant surgery was the only answer for you? What held it up?
Well, my mental state, because of the problems I was having. And
so how did you resolve that? What did you
well, I got my kids grown and on their own, and I got rid of my ex-husband, and because he was an alcoholic and he wasn't helping me at all.
They felt you didn't need that extra stress.
Right, right, and I didn't need that at all. So I just got on my own and made up my mind that I wanted to live. And so for 4 years I really fought a battle to live and stay alive and to get myself into condition for the surgery. And I made it. And
now regarding the funding aspects, it's a very expensive procedure, so the hospital demanded a certain amount of money up front, I guess, to do this type of work.
$100,000.
$100,000.
That's right.
Well, I trained at Stanford, and I worked there 3 years. I know what goes on there with the expensive equipment and the many days you have to spend there, and the operating room costs and the doctor's costs and all of these things that had to be covered. And Medi-Cal coverage, insurance coverage wasn't going to take care of it.
No, Medi-Cal does not cover you.
Is that considered because it's experimental still? Or
right. At the time, well, it's getting to a point now that it's not getting experimental. I mean, they're doing a lot. I was number 35.
Oh, really?
And so far they've done about 41, total 41,
all at
42.
Stanford University.
Right, and everyone's been successful.
So tell us how this fundraising campaign went. That was really all local, wasn't it?
Yeah, it was amazing. I mean, when they told me I had to raise $100,000, I said, my God, where am I going to get that kind of money? So I started call the Moose Lodge, Elks Lodge, people like that, organizations. And someone told me to go to Easter Seals. And so I did, and I talked to Leanna Costello, and she said she couldn't help me financially, but she could visit with visibility. And December 5th, when we had our first press conference, and that got it started.
And I know the firemen got involved.
Right, the fire department, and the Moose Lodge, the American Legion, and Don McCullough.
Yes,
and
very helpful.
Right,
yes.
Everybody. I was really...
And then the news media was very helpful.
Yes, Channel 3.
I saw you on
Channel
Sacramento
10.
television, and saw you here on Channel 5. We were watching you everywhere.
Yeah, I was...
You're ready to have
really
you go to
happy.
Hollywood after the surgery.
That's what I thought. But Dr. Kapos came into my life in 1983 when he took my case.
And he was helpful to push this through, too, wasn't he?
Right, he was very helpful. I mean, he stood by me all through this. And matter of fact, he got me in shape these past 3 years.
Now that you've been through the surgery, would you describe it as an extremely painful thing to go through?
Yeah, I would. I'd rather have
You're
a baby.
You're not going to make light of it, huh?
No, I'd rather have a baby.
What happens at Stanford? Let's say you're approved for surgery and they notify you via this beeper, walkie-talkie, or whatever they have you do.
You have to go through screening. And
you go back and you're ready to go. What happens the day you go in? You're ready for the surgery. They tell you they found a donor, heart, lung. And what happens next?
Well, what happened to me was I got my call at noontime, and I had 5 Learjets on standby.
5 Learjets?
Yes. I wanted to make sure I got there on time. And
they fly you into Palo Alto Airport?
Right. The one came out of Reno and flew me from Marysville Airport to San Jose.
Oh, San Jose.
Right. And then the ambulance picked me up at San Jose Airport, and they couldn't figure out why I was walking. They thought I was supposed to be laying down, But I said, I'm going to walk in here, and I'm going to walk out of here. and that's it. I'm not going to be wheeled in, no way. So I got there at the hospital, and they took me to my room, and they got me all prepared, IV, the whole thing. They put the plasma in my body and gave me rejection medicines to get me...
They had to start that going.
Right away.
Right.
And they kept extending my surgery every hour. And I was wondering, what's going on? You know, I want to get this over with. So that night they canceled it because they were working on the donor. They wanted to make sure that he was a perfect match.
I see.
And they were doing cultures and blood match tissues and the whole bit. So I said, okay, so they let me go ahead and eat. And that next morning at 5:30, they wheeled me into the operating room and said, it's time. It's time to go. And I was pretty well drugged, so I really didn't care.
How long did it take before you were awake and able to realize what had happened?
I understand I woke up later that evening and kind of in and out. And I remember the tube being down my throat because I barely saw that, but I knew it was there.
Nobody likes those in the throat.
No, because they were, I guess, pulling it out of me. And because I was breathing on my own, I was doing very well. And I think it was about the third days when I really got to sit up. And
that's when you feel the pain of the bones being held together by the metal sutures and things, wires, right?
Yeah. Oh, yes, I felt like King Kong was sitting on my chest, you know, and it was painful. And the rejection shots, the ones they give in the legs, are very painful. That's worse than the chest because the shot itself doesn't hurt. It's the medicine going into the muscle.
I see.
And the quicker you get up out of that bed to walk, the better. I had to learn the hard way because I got a little stubborn, and I wish I hadn't have. But that is the most painful, and it feels like you've got a real bad case of the flu and a Mack truck hits you.
How long has the pain been? Are you still having pain?
No, because I have been doing a lot of walking and dancing, and I went bowling for the first time in 5 years, you know, Wednesday night, and I was really,
well, you look
really
fantastic.
thrilled.
Are there any restrictions on your life right now?
No, just heavy lifting. And he said, you know about what you can do and what you can't do, so...
Does it feel strange to have somebody else's heart and lungs inside your body?
Yeah, it does. It did. And this is what they asked me also at the hospital. And I said, I feel bad because of the way the guy died, the donor. And
how did that happen?
I understand motorcycle accident, or it was another kind of accident.
Head injury type accident.
Right. It was brain death. And it was hard at first to accept, you know, knowing that how he died and everything. And I kept saying his organs and his lung and heart. Now I'm saying mine, but I'm keeping him alive spiritually.
Now,
and
I think it's fantastic because you look like you're ready for a whole new life here.
I am. I've got my own home now, and I'm able to drive, and I can walk up and down the grocery stores without having to stop to breathe.
And I understand you're even becoming involved in a fundraising campaign for another patient. We don't have any details yet tonight, but another patient in town who needs a heart-lung transplant.
Right, exactly.
And you and Dr. Kapos will be working on that, and I'm sure people will be reading about that and hearing about it in the media around town.
Right, yes. Matter of fact, I've been talking to this patient, and I'm helping her a lot.
I really have to say thank you very much for coming tonight.
You're welcome.
It's not every day that a patient who's gone through something as intense and as just dramatic as this is that will come on a TV program like this. But I think you've really helped our viewers understand what you've been through and to see how good you look now. And some of them really helped you, too, to do this, so it's great.
Yes, well, the Lord gave me the faith and the strength to really hang in there and just go through the ordeal what I had to go through. And he's the one that really helped, and the prayers, the public.
And it's just all fantastic. Thanks again, Nancy Brewer, for being here on the Medical Explorer tonight.
Thank you, Bob.
My pleasure. Before we close tonight, I'd like to introduce you to a treatment that dermatologists like myself use to treat difficult chronic skin diseases like psoriasis. Let's leave our Medical Explorer studio now and visit my Skin and Allergy Medical Group office and learn about phototherapy. The heartbreak of psoriasis. Is it really a heartbreak? Well, many of you don't even know exactly what psoriasis is all about, so let me start by telling you. Psoriasis is a condition that I see here quite frequently at my office, the Skin and Allergy Medical Group of Yuba City here on Del Norte and Shasta. In a dermatologist's office like this one, patients will come in complaining of red, scaly patches on their skin, most commonly on their elbows, on their knees, very frequently in their scalp with a lot of crusting and scaling. It doesn't have to itch. It can just be there with red, scaly patches just present. Many times they're not annoying. Just one or two on the elbows doesn't seem to bother people. But very frequently, the patient will have worsening. It'll spread. It'll go to the buttock areas, the legs, the arms, in the worst situations, even the face. And people come to a dermatologist asking for more help. In treating psoriasis, which is a hereditary disease, a skin disease that runs in families, there's no cure, so we have to find things to keep the condition under control. We start off with creams, cortisone creams you've heard of. We add things to the cortisone creams like tar products. Tars have been used for many years. And then if they don't work, we're faced with trying to find something stronger. And the latest innovation in treating psoriasis is using phototherapy. Phototherapy is the use of ultraviolet light. That's ultraviolet light, same as produced by the sun, on the skin can actually help clear up psoriasis. And in many dermatologists' offices nowadays, we have a machine that will produce this ultraviolet light. Now we have to compromise here because some ultraviolet light will start to damage the skin. But when a patient comes in with so much psoriasis that they have a miserable life, it's often worth taking the risk. So they'll come in, sometimes looking like these pictures, with the large red scaly patches on their buttocks or on their chest. They can have it limited to their hands or their feet. And they'll ask for help. We'll tell them about the ultraviolet phototherapy, where they'll stand in front of an ultraviolet light machine, and I'll show you now exactly what's done during what's called phototherapy.